Today, we are diving into a really intense topic, the management of rhinocerebral mucormycosis. Now, I know that's a mouthful, but what we're really talking about is an incredibly dangerous and fast-moving fungal infection. This isn't just some disease, it's a full-blown medical emergency. It's a race against the clock, where every single hour counts.
So think about this. The fungus we're talking about, from the order Mucorales, it's literally all around us. It's in the soil, it's in decaying plants. For most of us, it's totally harmless. But for someone who is immunocompromised, this everyday mold transforms into an absolutely ruthless killer.
And when I say killer, I am not exaggerating. A review of over 900 cases found a truly staggering statistic. For patients who got no treatment whatsoever, the mortality rate was 97%. You heard that right. Without intervention, death is pretty much a certainty.
So what exactly is this thing? Well, mucormycosis is what we call an opportunistic infection. It basically seeks out a host whose defenses are down. We're talking about patients with uncontrolled diabetes, people with certain types of cancer, or individuals who've had an organ transplant and are taking drugs that suppress their immune system.
Here you can really see the invasion on two different scales. It all starts with inhaling the spores. On the left, these MRI scans show the devastating result as the fungus just tears through the sinuses and starts invading the brain. Then on the right, you see the culprit up close, the fungal hyphae. These are these tiny, thread-like filaments that are just incredibly aggressive. They don't just grow on tissue, they actually invade blood vessels, choking off the blood supply. And that's what causes the massive tissue death you're seeing in those scans.
So how in the world do doctors even begin to fight back against an invader that moves this fast? Well, it all kicks off with what can only be described as a diagnostic sprint. There is absolutely no time to waste.
This quote from a study on cancer patients just puts that urgency into stark, brutal perspective. Delaying the start of antifungal medicine by just 6 days or more doubled the mortality rate. It's a terrifying reminder that every single day is absolutely critical.
And this chart, wow, this visual tells a terrifying story. If you get treatment early, within that 6-day window, the mortality rate is about 49%. Okay, it's basically a coin flip, but it's a fighting chance. But if that treatment is delayed past 6 days, the rate just skyrockets to nearly 83%. You can practically hear the clock ticking.
So for doctors, they have to maintain what's called a high index of suspicion in any at-risk patient. They use a whole combination of tools to figure this out. CT and MRI scans to map out just how far the disease has spread, endoscopic exams to get a direct look inside the sinuses, and then, and this is the big one, a biopsy of any suspicious, dead-looking tissue to get that definite confirmation under a microscope.
The second that diagnosis is confirmed, or even just strongly suspected, an immediate and incredibly aggressive counteroffensive has to be launched. The strategy is this simultaneous, two-pronged attack. On one side, you have aggressive surgery. Surgeons have to physically go in and just cut out all the dead, infected tissue. This can mean multiple, really extensive operations. And at the exact same time, the patient is started on high-dose intravenous antifungal medication. The drug of choice is liposomal amphotericin B, and it's designed to hit the fungus hard throughout the entire body.
And this aggressive approach, it's completely non-negotiable. And there's one simple reason why, which the research sums up perfectly. For this disease, doing nothing is a death sentence.
But fighting the fungus directly is only part of the battle. The other absolutely critical piece of the puzzle is reinforcing the patient's own weakened defenses. You have to treat the host, not just the infection. A successful outcome really depends on what experts call these 5 pillars of intervention. We've already talked about the first 3: early detection, getting those antifungal drugs in fast, and surgery. But pillars 4 and 5 are just as important. You have to reverse the patient's immunodeficiencies and correct the underlying metabolic problems that let the fungus get a foothold in the first place.
So what does this mean? It means doing everything you can to help the body help itself. For a patient with diabetes, it's about aggressively getting their blood sugar under control and fixing something called acidosis. That's a dangerous buildup of acid in the blood. For a transplant patient, it might mean lowering the doses of their powerful steroids, or even pausing other therapies that suppress their immune system. Essentially, you have to slam shut the very door the fungus walks through.
And let me tell you, this is not a job for a single doctor.
Success demands a rapid, coordinated effort from a whole team of specialists. We're talking infectious disease docs, surgeons, eye specialists, and the critical care experts in the ICU, all of them working together, treating this like the top-level neurosurgical emergency that it is.
So, after all of that, this all-out, multidisciplinary assault, what does the fight for survival actually look like? What's the outcome?
This simple table really tells the whole story. Remember where we started? A survival rate of just 3% for untreated patients? But by combining that aggressive surgery with powerful antifungal therapy, that number jumps dramatically. Studies show survival rates climb to between 50 and 69%. It's still a devastating disease for sure, but this approach proves that this battle can absolutely be won.
So, an aggressive, coordinated, and fast approach has turned what was once a universally fatal disease into a winnable fight. But let's be clear, with mortality still so alarmingly high, the work is far from over. The search for faster ways to diagnose this and for newer, more effective therapies is more urgent than it has ever been, because for these patients, the race against time continues.